Well, first of all, when we move to any of these countries like United States or Canada as a foreign qualified dentist, then we have so many challenges to face. And we don't know in the beginning that what to do, which path to take, from where to start, etc., etc. Well, there are various opportunities. And I always tell my students that do not miss any opportunity. Try to go for all the opportunities, and whichever you would be able to accomplish, then that is your destination. So let's start exploring that what the dental field is offering to the internationally qualified dentists, both in the United States as well as in Canada. Keep in mind, if you do your DMD or DDS from United States, you can practice in Canada. And similarly, if you will be doing your DDS or DMD from Canada, you would be able to practice in the United States. But Canadian license won't let you practice in the United States. Acquiring a dental license in Canada. First of all, let's start with that. Well, all of us are familiar with this equivalency process, that the exam of assessment of fundamental knowledge, then the two exams which are assessment of clinical judgment and NDEC exam. Previously, it was ACS exam. Well, over here, we have another pathway which is known as qualifying degree completion program. Previously, after passing your AFK exam, when they were giving you your examination scores, you were able to apply to the universities. But since 2021, when they stopped giving the scores for your exam, the passing scores, if you, God forbid, you fail, then they definitely send you the marks. But if you pass your exam, then they just let you know that you have passed the exam without telling you about your marks. So there is now another exam they have using, which is by the American Dental Association, and that is known as ADAT, which we are going to discuss later. Well, after that, the assessment of clinical judgment exam, you can go for NDEC exam. No matter you are coming from the qualifying degree program or you are coming after passing the NDEC exam, you will be going for NDEB written and objective structured clinical exam, OSCE. Then you will be getting the NDEB certification, and finally you will go for your provincial licensure. As I told you, that ADET is the exam which was introduced by American Dental Association a couple of years ago, and now most of the universities in Canada, they are relying on the ADET because ADET is offering the score, passing score. And on the basis of that, they are selecting the students to go into the qualifying degree completion program. Well, Well, first of all, to start with the Canadian procedure, you need to make your profile at NDEP. And over here, this is the link that it will give you the directions how you can apply to the NDEP, and NDEP is going to give you your identification number. Well, every country, they have different, like from wherever you have qualified, like if you have qualified from United States, from the United Arab Emirates, or you have qualified from Afghanistan or India or Pakistan, so required documents would be slightly different. So you have to check which are the required documents for you to submit. And then you also have to go through the application guide and other resources developed to help with the application process. This information has been developed to help you submit the correct documents in the record. Because if you are not submitting correct documents, it may take longer for your credentials to be verified. Once your credentials are verified and you have already created your NDEP Connect account, then you are going to apply for the first exam, that is Assessment of Fundamental Knowledge exam or AFK exam. Usually question is being asked that how many months are required to pass this exam. Well, 5 to 6 months preparation if you are preparing wholly solely and you are relying only on this without getting distracted, that would be sufficient. This exam occurs twice a year, February and August, and you have 3 chances to pass this exam. Passing percentile is 75%. There are 200 MCQs which are offered in two parts, like part 1, 100 MCQs, and part 2, 100 MCQs. Previously, there were 300 MCQs, but they have reduced the number. This exam covers all the basic as well as the clinical subjects, just like American boards exam, which we call INBDE. Well, then comes the assessment of clinical judgment exam. Well, for that, you need at least 3 to 4 months preparation. Experienced clinicians, they take lesser time, but those who are fresh and only they have done their house job, probably they will take longer, and definitely they have to put much effort in understanding the clinical terms and the clinical procedures, how you are going to assess one person for the oral pathology cases, for the perio cases, etc., etc. Again, there are 3 chances for this exam. And same, the passing percentile is 75%. This is a computer-based exam in 2 sections. AFK exam could be offered paper-based or could be computer-based. But this exam is purely computer-based. Both these sections comprised of case scenarios with MCQs and multiple correct answers, as well as periapical and bite-wing X-rays with MCQs and multiple correct answers. In total, there are 150 MCQs, 75 in each section at an average. It could be lesser. At times they give you 72 questions, at times they give you 77 questions, but around 75 questions in each section. More emphasis on oral medicine and oral pathology, periodontology, specifically the new classification of periodontal diseases, medical emergencies, management of a medically compromised patient in the dental office, etc., etc. Well, at times they give you 1 case of orthodontics, at times they give you 2 cases of orthodontics, depending upon who is making the exam, but definitely at least 1 case of orthodontics will be there. A lot of questions on pain of endodontic origin and its management. Then questions about the analgesics, antimicrobials, and local anesthetic doses are also being asked. Well, previously they were not asking about the prescription writing, but when they realized after a couple of years that the people who are coming from other parts of the world, they have problem in writing the prescription. So they have included prescription writing in the ACJ exam as well. They show a prescription which is a part of that case scenario and ask if it is acceptable or it is inappropriate. If it is inappropriate, then on the basis of what factors? Well, in Canada, the North American norms are being followed to write the prescription, and we do not prescribe antibiotics or other medications without any reasons. There must be a valid reason to prescribe the antibiotics and other medications. Then comes the NDEC. NDEC has 2 components, the clinical skills and the situational judgment. In clinical skills, there is a set pattern. Previously, they were giving you simulated teeth, but now they have changed the pattern. They are giving, those were 200 series of the typodont, but now they are giving you 700 series of the typodont whose morphology is different and teeth are slightly harder as compared to the 200 series, and they are not simulated. They will ask you one typical class 2 amalgam cavity preparation, class 2 amalgam filling, class 2 composite filling, class 4 composite filling, a full veneer crown preparation. It could be PFM or it could be all ceramic. Then on your own preparation, you will be constructing a provisional crown. And then the endodontic excess cavity preparation. Previously, only molars were given, but now they are also giving anterior teeth as well. Component two is the situational judgment after realizing that those people who are coming from other parts of the world, they have problem in communicating with the staff, they have communicating with their employer, they have also problems with their employees, and they have problem with the dental assistant as well as the dental hygienist and patients as well. So they introduced this exam. And over here in this exam, they would be looking for your patient-centered care. You have to assess the caries risk, manage the patient's needs, gather data, develop a problem list, establish the diagnosis, sequence the treatment, plan the treatment, and then how you keep the dental records. Then comes the professionalism. They would be looking for the how you are going to respond to some ethical dilemma. Maybe it could be a rift between two of your employees who are having problems in cleaning after the work and how you are going to sort out that situation. Or maybe it is between your hygienist and one of your patients who is giving some trouble to the hygienist. So, how you are going to sort out things? Like there are various scenarios they can give you, and even at times it would be kind of a stage thing. There are actors, and those are qualified people, those actors are, and they are assessing you. Then how you are going to manage the referral? Like say for instance they present you just like maybe it could be a real case or it could be just one actor, and patient would be complaining of third molar pain, and like in the scenario they will be saying that it is a third molar which is like distoangularly placed, and etc etc, and you need to refer it to the specialist. So which specialist you will refer and how you will write the referral letter, etc etc, how you have to use the social media appropriately. Then communication and collaboration, as I told you, maintaining the privacy, then maintaining the records, writing the referral, and writing a lab prescription, which could be usually writing a lab prescription for a removable partial denture. Keep in mind, in this part of the world, RPD means a cast partial denture, not the plastic plate. So whenever you will be asked to write a prescription for the RPD, it means that you would be writing the prescription for the lab for construction of one cast partial denture. Well, discuss the treatment plan, document informed consent, how you are going to take the informed consent, then demonstrate cultural competence. They can create some situation where there would be some problem, like a lady doesn't want a male dentist to touch. So how you are going to handle that situation? There are many things which they can come with. Interact with the staff, which I just told you, give post-op instructions, then practice and information management, manage the patient records, then follow the protocols, make evidence-based decisions. Nowadays, like since 2021, evidence-based dentistry, it is gaining much more popularity in this part of the world. And keep in mind that evidence-based medicine was firstly evolved in Canada at the McMaster University. So we are the pioneers, and that is why they are emphasizing a lot on evidence-based practices. Then comes the health promotion. Examples demonstrate an understanding for social determinants of health, promote access to care for all individuals, promote measure to prevent oral diseases, injury, advocate for patients. The scenarios in the above table, they are just examples. and they can change it. And of course, every exam set, some new scenarios, some new problems are going to be, because problems could be variable, and they just want to see how you are going to tackle with the situation, especially a tough situation. You have to follow the rubric. Well, then comes the OSCE and written exam. No matter you are coming from United States after qualifying, or you are coming from the university, or you have passed your NDEC exam, every person has to go through the OSCE and written exam. This exam is mandatory for every dentist. So 2 days exam, 3 chances are provided to pass. Passing percentile for written is 75%. Day one is just like your AFK written exam. It will be MCQs and you have to pass that 75 percentile. Then day two is OSCE exam with multiple stations and problem-based questions or case scenarios with most appropriate answers. Upon completion, NDEP awards license to practice, but it is not a guarantee. You have to go through another procedure with your provincial licensure body where you are intending to practice. You can get a license for 2 provinces. You can get a license for 1 province. Like many people I know, they are practicing in Ontario, but they have opted to work in the prairies as well. So once in a while, like maybe once in a month or once in 2 months, they fly to prairies, because over there the uh, availability of dentist is not good and the pays are very high. So they go over there and they practice. So you can get the license for even 2 provinces as well. Well, alternate path, as I told you, you can go to the dental school, and over there you have to spend 2 to 3 years. Previously, it was AFK, but only probably one university is asking for AFK exam. Rest are going for ADET exam now. So, first of all, requirement to go to the university, Canadian citizenship or PR. Only University of Manitoba was offering some seats for the international students, but they are probably 2 or 3 seats. You need to have good GPA, then TOEFL or IELTS score. Every university, they have their own criteria to shortlist these students for bench exam and for interviews. Getting into the Canadian university is highly competitive. University of Toronto, it requires ADET exam. Manitoba requires ADET exam. Alberta requires now ADET exam. Previously, they were not asking for ADET exam. Dalhousie University, it requires AFK exam. I think they have changed it this year, so we have to look into that as well. And Western Ontario, it was requiring previously AFK exam. I think they have also changed the requirement to ADET, but we have to check it. McGill, definitely, it was the first university which started with ADET exam actually. Saskatchewan, it requires ADET exam as well. Saskatchewan is also offering another qualification, which is known as the dental health provider type of thing. And for that, you also need to pass the ADET exam, and that is specifically for the foreign qualified dentists. So they call it dental therapist actually. And you will be then licensed to practice only in the Saskatchewan. You need to go for WES course by course assessment if you want to apply to these universities. Bench exams and interview, every university, they have their own criteria for selection. As I told you, University of Toronto and McGill University, they interview only. GPA is given a lot of weightage after scoring high in the ADET in case of UFT and ADET in McGill. McGill doesn't go for your GPA, but again, we don't know their criteria. Many very good candidates, they were not being shortlisted for the interview, and many average students, they were shortlisted for the interview. Western Ontario, you have to attend their prior learning assessment exam, and for that you have to go for the preparatory course as well. They conduct their own preparatory course on a weekend basis, and it is better to attend that course. And then they shortlist you to apply for their in that university. In their exam, they ask you 6 exercises on typodont. They are not simulated teeth, they are regular normal teeth. And they ask you to complete it in the prescribed time. It is like 2 days bench exam. Dalhousie, you have to just go there for one day and you have to complete 2 exercises on the typodont. Then there is one written exam, and then there is an interview in the same day. It is very very tedious and very like strenuous. It starts like maybe 8 a.m. in the morning and finishes by like 5 p.m. in the evening. Alberta University, in person or in Zoom. Previously, their exam was different. It was like based on 6 days of your presence over there. And every 6 days, they were giving you different exercises, and you have to perform the whole day work on the typodont, like cavity preparation, fillings, etc., rubber dam application. But now they have changed the system. Like till 2022, they were taking the interview or this OSCE type of exam on Zoom, but at times they also ask you to come in person. So it is kind of the OSCE type exam, and then there will be a panel interview. University of Manitoba, 2 days of exam having practical, written, and interview components. And Saskatchewan University, firstly, you have to pass their practical exam on typodonts, and then, and yes, they give you the simulated teeth, like the carious teeth, and you have to remove the caries, and then they ask you to fill the cavities which you have prepared. And then if they feel that you are appropriate candidate, then they interview. It is a panel interview. Cost for direct licensing: you have to have the fee for evaluation process, then fee for the AFK exam, fee for ACJ exam, and fee for NDEC exam, then fee for OSCE and written exam. Study material cost, and then the preparatory courses fee, dental materials, instruments, typodonts, simulated teeth for practice and training, course cost, etc. Time required if you go for like you are starting from today and you want to finish it. So if everything goes smooth and you get the slots in the exams easily, so somewhere between 18 to 24 months, but it can extend. When you pass your ACJ, you will be having 5 years to pass your NDEC exam. NDEC exam does not have limitations. Like other exams, they have limitations of 3 attempts, but NDEC exam, it does not have any limitations. Similarly, in NDEC exam, if you pass one component, you can appear in the second component without appearing for the other component which you have passed. It could be a situational judgment, it could be the clinical skill, whatever. Cost for university programs. So you need to have fee for your evaluation, fee for AFK exam, then study material and prep course fees, then university fee, books, residence, computer, instruments, and supplies. Time required after AFK or ADAT, at least it takes 1 year before like they will ask you to appear in the interview, they shortlist you, and then they again call you for the bench exam and whatever the situation is from the university. So it may take up to 1 year. And then the classes will start, and then 2 years to 3 years of dental school. Well, now question comes that, okay, we are here, but side by side, there are more universities in United States and some new universities, they have also started their dental schools, like in New Mexico, etc. So if we go there and acquire dental license in the United States, so what would be the procedure? Keep in mind these two terms, accredited and non-accredited dental schools. The Commission on Dental Accreditation, which is known as CODA, it serves the public and profession by developing and implementing accreditation standards that promote and monitor the continuous quality and improvement of dental education programs. Well, as I told you, reciprocally, the Canadian schools, they are approved by CODA, and similarly in Canada, American schools are also approved. So vice versa. But before getting admission to the American school, you need to still confirm with the NDEB, are they still accepting the graduates of that dental school or not? Because you never know. Things change over here, even overnight. Well, individuals attending dental programs in one country and planning to practice in another country should carefully investigate the requirements of the licensing jurisdiction where they wish to practice. Dental studies in the United States. If somebody is coming from the high school, after high school, they have to go for 4 years of university in the health sciences, then they appear in the TET exam. After that, 4 years of dental school, then they have to appear in the American boards, and then the regional boards where they have to practice. But we, the people who are coming from other parts of the world, we miss this 4 years of university in health sciences, and we don't go for the TET exam as well. So they have made system a little bit difficult for us. We are coming from the schools which are called non-accredited programs. Our qualifications would be BDS or DDS, no matter what, because in Iran, many people, they get qualification as DDS, but that DDS is not equivalent to the DDS of Canada or United States. Steps for the foreign qualified dentists: documents verification using ECE and W. But keep in mind, if you have to appear in the exam, ECE is mandatory. WES is required by some of the universities, but first thing first is you have to pass the exam. So you have to get your ECE evaluation done as the first step, and get the dent pin. Dent pin is your identification by the American Dental Association, and that will be for life. So once you get your dent pin, keep it safe and don't share your dent pin number, and don't share your password, which you use to log in into the American Dental Association website with anyone. Anything can happen. I'm just letting you know. And if anything happens, then you will be in trouble. The American Dental Association is not going to take any responsibility for that. Previously, there were two exams which were conducted by the JCNDE. NBDE Part 1 and NBDE Part 2. But now, since September 4, 2020, they have finished this NBDE Part 1. The last exam was taken in December 31st, 2020 for all qualified dental candidates, regardless of whether or not they were trained by CODA accredited dental programs or not. NBDE Part 2, it continued till December 31st, 2022. Now they have made one exam, which is known as INBDE. And INBDE is basically exam which would be asking questions both on the basic sciences as well as on clinical sciences. Well, another exam, as I told you, which was introduced by American Dental Association, that is ADET, and even all the Canadian universities, they are accepting passing scores of ADET. So this is the ADET, which is also known as Advanced Dental Admission Test. It is used by 400 plus advanced dental education programs to assess applicants' potential for success. The test takes 4.5 hours to complete and is offered at test centers throughout the United States and Canada. The ADET consists of multiple choice test questions presented in English and includes a battery of 3 tests. Biomedical Sciences, 80 MCQs. Clinical Sciences, 80 standalone and case-based item. Like they will give you one case and maybe 2 or 3 questions on the same case. Patient's age, patient's gender, patient's chief complaint, and then any medical history, any drug history, it would be mentioned. And then the questions will be based on that. Then data, research, interpretation, and evidence-based dentistry, 40 items. This is the most difficult part of ADET exam. Now, some of the Canadian dental schools, including University of Toronto and McGill University, as I told you, they accept the ADET. Like now, most of the dental schools, they accept it. Then comes the English proficiency, TOEFL, IBT exam, written, speaking, reading, and listening. The application process for the American universities, there are two types of universities in America, in United States, CAPID universities and non-CAPID universities. CAPID is a platform where you will be making a centralized application and then you choose the programs of your choice and apply it there. ADEA, it has made the CAPID platform. So ADEA is centralized application for advanced placement of international dentists, that is CAPID. It is available to all individuals applying to the participating programs. Applications to ADA CAPID are internationally educated dental graduates who wish to practice dentistry in the United States or Canada. ADEA CAPID includes advanced standing programs which are typically shorter in length compared to traditional DDS and DMD degrees. Like the conventional, I told you earlier how their whole process it runs. Those students who are coming after doing their grade 12. Well, at CAPID, you will be making your profile. Then there will be letters of recommendation, electronic now. Previously, they were like physical letters, but now electronic. The statement of purpose. This is how you sell yourself. You tell about all your good qualities and why the university should select you for that program. Then TOEFL score, NBTE exam result, ECE evaluation, selection of program from the list available. Supplemental application forms, paper-based or electronic, letters of recommendation, supplemental application fee, and other required documents. Every university, they have their own requirements. So supplemental application, it consists of all these. Then after that, they shortlist you and they will call you for interview or bench exam, or maybe both. And then they will go for the final selection. Finances for the universities. Well, if you have your own funds, you are good, but you can go for bank loans. If you are going to American universities, probably you will need a cosigner. That is not required by the Canadian citizens in Canada, but if you have good credit scoring. But if you are going to United States, so probably you will need a cosigner, which could be your spouse or your friend or your parent or anyone who is working and getting some good salary, or maybe who are in dental practice and or maybe doing anything else, their own business, etc., etc. After that, degree completion and regional boards, and then you are ready to practice. You can practice in United States after doing the regional boards, or you can come back to Canada and after appearing in the OSCE and written exam, and then going for the regional licensing procedure, you can, like the provincial licensing procedure, you can practice in one or two provinces of Canada easily. ADA pass. This is another path. Most of the people, they don't talk about it. The American Dental Education Association Postdoctoral Application Support Services. It is a centralized application service for individuals applying to advanced dental education programs. ADEA PASS simplifies the application process by allowing applicants to complete one standardized application rather than individual applications to each program. Well, after doing these appropriate tests, which I have told you, yes, for PASS, you need to go for GRE as well. Some of the universities, they ask for ADET. Then after going for the master's program, then you can go for the diplomate and board certification. So if you get the master's, then you, after doing a little bit of the work, you would be able to appear in diplomate exam and you will be given the award of diplomat of that board, that particular, it could be prosthodontics, it could be endodontics, it could be implant dentistry, it could be orthodontics, etc., etc. Well, direct licensing in United States, that is a tricky question. Only few states on individual basis after a person passes NBDE exam and regional boards may be awarded direct license, but it is not a very uh, extensive practice in the United States. Few people, they got licenses directly, but of course they had like some very good background coming from England or from Australia or from New Zealand, etc., etc., or maybe somewhere in Europe, and with like 10 to 12 years of experience, they got this direct license. General dental residency programs for foreign trained. This is another thing usually people don't talk about it. The advanced standing program for foreign trained dentists does not focus on specialization, but rather all subjects taught in a dental school. It is basically a bridge course making an international dentist equivalent to any US trained dentist, and with this program you will repeat 2 years of dental training to be eligible for dental licensure in the United States, but it does not give you opportunity to practice anywhere in United States. There are few states with restricted practice, but still you would be practicing dentistry. There are certain programs which hire you and you would be able to practice dentistry. So it is one of the pathways as well. Many centers which offer this, like Howard University, Tufts, Metro Health Medical Center, Abingdon Memorial Hospital, but you have to, sometimes they take it back, sometimes they reintroduce it. So you have to Google the general practice dental residency programs for foreign trained dentists, and then you will find the list and then their requirements, and you apply accordingly. Choose your path wisely. There is no shortcut to success. Remember that. If you will be looking for some shortcuts, probably you will end up to follow some one of the most tortuous paths. There is a process and you have to go through the process. There are no shortcuts and there are no ifs and buts. Keep all your options open. As I always tell my students, that keep all your options open. No matter you are going in Canada for the direct license, or you are going for university program in Canada or university program in United States, or even if things are not making sense to you, you can go for ADA pass as well. So over here, we are done with our first part. And after 10 minutes of break, we will start with our second part.